My name is Emily Kramer-Golinkoff. I am 33 years old with cystic fibrosis, and I have 2 nonsense mutations. And I run an organization called Emily's Entourage, a 501c3 that accelerates research and drug development for nonsense mutations of cystic fibrosis. And so I am really excited to be here with Dr. Marty Solomon from the University of Alabama, who leads the RARE trial. And I'm wondering, Dr. Solomon, if you can tell us a little bit about the study, why it's important, and specifically why now?
So the RARE trial is trying to get at the lack of drugs for patients that have mutations like your own, which are these nonsense mutations. And we're trying to develop drugs for these individuals, but we need tissue to be able to study these rare mutations. But we don't have a lot of that tissue because these are relatively rare mutations. And so we're trying to get that tissue in a way through this RARE network by recruiting patients to come to certain centers that can collect this stuff in a very particular way and help us biobank it so we can then use it to test new drugs. And one of the things we're getting is human nasal epithelial cells, which are pretty easy to collect. And they're really good, and they give us some initial information about the drug response. But we're ideally trying to get other tissue types like induced pluripotent stem cells and then cells from the intestinal tract, from the distal intestinal tract, in a way that, because they can be grown for several years, and so they can be useful for a long time. And so the purpose of the study is to get a diverse number of different cell types. We can really make sure we have a good portfolio of tissues to be able to investigate drugs and hopefully help people like yourself.
So what can we, patients with nonsense mutations, do to help expedite the process?
Yeah, I think 2 things. The first is being willing to participate in these early trials that are trying to biobank tissue and get early drug discovery. That's the first thing. And the second thing is like yourself, be an advocate for this being an important issue for the CF community. You know, kind of having the willingness to go along with the process and help us, especially with enrolling in the study. If you're willing to, that would be a huge help.
So speaking of enrolling in the study, well, I can actually speak from experience. I think I was one of the first people to participate in the study. It seemed to me that a lack of cells to study has been a hurdle, and that's something I can easily help with. And so I wanted to start banking as fast as possible. I mean, I didn't want.
Emily, do you think that the rest of the nonsense mutation group patients feel the same kind of urgency as you do?
I think absolutely.
Okay.
I think, I have to say that, being surrounded by so much huge hope that doesn't apply to you is a really, it's a hard place to be. And, you feel so happy and grateful for the rest of the CF community, but we want it too. We want to join them. And so I think that for me, I was like, I wanted the trial to start yesterday. And so I wanted to get my cells in there and help as fast. And I think that when you realize that there's something you can do that will help, that's so empowering to realize that you have something that could help bring about the change that you want to see.
What was your experience with getting enrolled in the study?
So I had worked with the group at Cincinnati before.
Yeah.
I've had nasal brushings, 10, 20, 30 times. So that was really nothing new. Having the nasal scrape it's uncomfortable in the moment and then goes away immediately after. I wouldn't call it painful. I'd call it uncomfortable. And I also had already had an intestinal biopsy before. So this was my second time. I was given the advice, which was really good advice, that the worst part of an intestinal biopsy is just that it is socially uncomfortable. The actual process is even less painful, I would say, than the nasal brushing. It's just awkward. And, when you're working with professionals who do this, day in and day out, this is what they're used to. It's not awkward for them. And so you kind of just swallow your pride for a couple minutes. It's really not a painful procedure. The team I worked with was so lovely. it is with our cells that drugs get discovered and get developed, and that can't happen without having ample samples of cells in all different formats. You know, patients are listening, or family members, and they are interested. Where can they get more information, and how can they sign up?
So the best way to get information is this. All of the centers, the clinical centers, can refer patients to one of the 6 sites for the investigation study. And so contact your best friend at your CF center and tell them, I'd like to be involved with this study. And they can simply put a referral, and that actually helps their center to be involved with the study in a particular way, and then gets the information directly over to one of the lead research quarters at the 6 sites, and they will get all the information by direct contact of the patient once we've gotten the clear from the clinical center.
The one extra piece that I'll add to that is make your centers go fast. You know, go as soon as you can. Sign up quickly. Tell people to sign up quickly, because our speed will dictate the speed of this trial, and this trial gives us hope.
Thank you, everyone. If you're interested and intrigued by what we've talked about today, we hope that you'll look on the Clinical Trial Finder on cff.org and search under the RARE study. This will give you all the information you need to refer yourself for involvement in this investigator trial, and hopefully provide the information to get this moving forward.
Thank you, Dr. Solomon, so much for joining us today. Thanks. It's been fun catching up, and I hope you all sign up quickly. Thanks so much.